key to ensuring a healthy recovery. Here today to talk about back injuries and treatment options is Dr. Alfred Hicks, an orthopedic surgeon at the Connecticut Orthopedic Institute at Midstate Medical Center. Doctor, welcome.
Thank you. Thank you for having me.
Great to have you. A lot of people suffer from this, so what should people do when they injure their back?
Well, as you said, this is something that's pretty common and will be increasingly common as people are out and about enjoying the beautiful weather. And so the first thing would be to stop doing what you're doing and take a little bit of a rest. Maybe try some ice and some anti-inflammatory medications to begin with.
All right, doctor, tell us about some treatment options for back injuries.
So, initially we try simple things, rest, ice. Sometimes people find heat is beneficial, and some simple medications like anti-inflammatory medicines. For most people, that's going to do the trick, and they're going to feel better after a few days.
All right, and doctor, a lot of people injure their back. Does everyone who has a back injury need surgery?
No, there are a lot of people that have some sort of back injury that respond to the initial things that we just talked about, and that works for just about everybody. But there are some that the back pain persists, and for some of those people, when they come and see me or they see their primary care doctor, we start other simple things like physical therapy. Some people do massage treatment. Some people go to chiropractors. So there's a lot of different options that are out there for people that have injured their back.
All right, for those who do need surgery, talk about the different types of surgeries for back injuries.
So again, we reserve that for people that are not responding to any of those other options. And when we've gotten to the point where their pain is persistent despite all of those options, first thing we would do is get an MRI and take a look. There might be a disc that's herniated. Some people respond to injections, but if you're someone who has tried many months of treatment and it hasn't gotten any better and you have back pain and pain in your leg, the simplest procedures are discectomy, which is a small incision. A spine surgeon or a neurosurgeon would get down to where that disc was herniated and remove a small piece of it, taking the pressure off of the nerve, which for a lot of people helps very well. There are other people who have perhaps additional issues with some instability, and for those people, they might best be served by a procedure we call a fusion. But it really is a matter of figuring out what the real problem is, making sure you've tried all of the conservative options, and if it comes to pass that you need surgery, finding the most simple procedure that would benefit you.
All right, doctor, we have information there. You have a webinar coming up May 17th, noon to 1. That is free on preventing back injuries. Thank you very much, Dr. Alfred Hicks. Thanks for joining us.
Thank you.